before we dive into today's topic, let's take a quick look at our agenda. We'll be joined by our esteemed instructor, Dr. Pierre Bouhanna, who will deliver a comprehensive presentation for about 45 minutes, followed by a 15-minute Q&A session. So please use the Q&A button on the bottom of your Zoom screen to submit your questions, as the attendees will remain muted throughout our session today. In total, our webinar is expected to last around 1 hour. And now I'd like to introduce our instructor. Dr. Pierre Bouhanna specializes exclusively in surgical dermatology focused on the scalp. He serves as a consultant at the Paris Saint-Louis Hospital, Sabro Center, and is the director of the University Hospital Pierre in Paris. Notable publications from Dr. Bouhanna include the phototrichogram, multifactorial classification, and FUL, unshaven long hair FUT technique. He has pioneered distinct transplantation methods for various hair types, with a focus on African and Asian origins, and is actively engaged in ongoing research involving stem cells, growth factors, and hair restoration for cancer patients. In 2015, he received the Platinum Award from the ISHRS, recognizing him as one of the world's leading hair transplant surgeons.
Hi, everybody. It's a pleasure for me to talk about a field that is very important, actually, and the development very tremendous about hair transplantation for Afro-textured hair. I think, first of all, we have to look with research about all the characteristics that Afro-American hair can have. And for us, we have noticed that Black Afro-Americans' hair and scalp have structural, anatomical, and physiological specificity. Hair culture and analysis of various parameters we have done according to ethnic factors, and for that, we have noticed schematically that for Black hair, we can have helicoidal and spiral hair shaft, an elliptical and flattened cross section, curved hair roots, a density less than 20% versus Caucasian, higher percentage of telogen hairs, and a growth rate inferior of 30% versus Caucasian. The characteristics of the scalp, because we have seen for the hair, but the scalp is almost a dryness of hair shaft, a scalp inflammatory reaction more than the other people, a risk of hypertrophic scars and keloid formation, risk of hyper or hypopigmentation, as you see in some slides. And we have to well known all the hairstyling practice to best with knowing this practice is better to avoid any problem with this kind of scalp. Of course, most of the treatments, medical treatments, are identical in all ethnic groups, but we have to take care for African Americans of the dryness of hair shaft, and to fight against that, to also to know that surgical treatments are specific because of the nature of curly shaft and curling roots. Like for other people, we can develop all the hair investigation before a hair transplantation. Clinical and tricolab diagnosis of the alopecia, of course. Sometimes we need the help of histological findings And at the last, we do a careful donor and recipient area evaluation with the global photography, multifactorial classification, and tricoscale. Why we are doing that? Because the clinical diagnosis is fundamental, it's very important. For example, this 30-year-old woman who experiences sudden alopecia areata following the abduction of her child. And we, after looking clinically, it's possible to say that this patient will have a complete hair loss, and that occurred, this complete regrowth after her child's safe return. More than other ethnic, we have a demand for